More of a mobilization with movement, specifically to help with end range extension, and very good for tracking because of the position we're in, okay? So it's going to be as simple as Macy will be performing a long arc quad while I'm providing the superior glide that's supposed to happen at the kneecap. Fair enough? Again, our mobilization movement concepts are that I'm sustaining as much but as little as needed to do pain-free and through the motion that we're going for. The key thing that's missed is on the way down. A lot of times people let go. We really want to sustain that on the way up, okay? This will be easy for all of you unless you have true stiffness, but post-operatively or at certain stages or PFPS, this is really helpful. So your guiding hand will be on the tibia. That way you can reinforce kind of what they're supposed to be doing. You might watch a rep or two, make sure they feel good. Macy's struggling on the way down, so we're going to support a little bit on the way down for eccentric. But we're here. The grip you're going for is to gather as much of this patella as possible. We would say frame the medial border, lateral border, and kind of try to wedge into that bottom. I try to create a V in my mind almost and wedge in. If you get too pokey, you can bother that fat pad and the patellar tendon. So try to be firm but supported there, and that takes some feedback. On the bone tends to work well. There's not as many sensors as on the soft tissue around it. So I'm right into those kind of facets of the inferior facets of the patella. I'm driving superior. The thing you need to pay attention to as a clinician is right now the direction of force is here, but in 1 degree it's going to go this way. In 1 degree, so I need to follow my force. So guess what I'm looking at, guys? The forearm the whole way needs to be swinging and providing the superior glide into where that rec fem is pulling it, okay? So Macy, I'm going to provide a little bit of mobilization here. It really shouldn't bother anything. You're going to kick all the way through. We'll hold at the end for a good 3 seconds, and then I'm going to stay here, but we'll guide you down, okay? Let's go through about 10 reps in a row. Sound good? So wait, let me produce my glide first. So I'm here, a little bit of force. Go ahead. Good. Come down. A little clunky. I'm going to try to give you a little less. Good. So Macy and I should still be able to find a smooth flow, kind of like when we get into the scapula, y'all. You should be able to smooth out the motion a little bit. Macy, what am I giving you? 3% effort here?
Yeah.
I'm not giving her a whole lot, but we kind of calmed down some of the shakiness. I would ask for her pain feedback. I'd really want her to hold, right? If I'm reinforcing that terminal knee, control down, drive back up, and relax.